Vaccine confidence is at an all-time low, and the consequences are becoming impossible to ignore. Once preventable diseases like influenza and measles are surging again, causing widespread illness and unnecessary suffering. This isn't just a minor setback in public health, it's a full-blown crisis with potentially catastrophic long-term consequences. The erosion of trust in vaccines is not only putting individuals at risk, but also endangering entire communities by dismantling the herd immunity that once protected the most vulnerable. If this trend continues, we are on the verge of undoing decades of medical progress, allowing diseases that were nearly eradicated to return with devastating force. This surge in illness is a direct result of misinformation, fear-mongering, and a growing rejection of scientific consensus. While vaccines have been one of the most successful public health interventions in human history, they are now being treated with suspicion, as if they are part of some grand conspiracy rather than a proven method of disease prevention. Social media has amplified this distrust, providing a platform for baseless claims, unfounded fears, and outright falsehoods. A single viral post, often shared by someone with no medical expertise, can do more damage than years of painstaking research conducted by experts. The result is a population that is increasingly skeptical, hesitant, or outright refusing vaccinations, despite overwhelming evidence of their safety and effectiveness. The consequences of this hesitancy are playing out in real time. The rise in measles cases is a stark warning sign. Once considered eliminated in the United States, measles is now making a fierce comeback, largely due to declining vaccination rates. The disease is highly contagious, spreading through the air and capable of infecting 90% of unvaccinated individuals who come into contact with an infected person. Unlike the flu, which varies in severity year to year, measles is an aggressive virus that can cause serious complications, including pneumonia, brain swelling, and even death. Infants, pregnant women, and immunocompromised individuals are especially at risk. Every unvaccinated person serves as another potential host, allowing the disease to spread unchecked. This isn't just an individual decision, it is a public health disaster in the making. Influenza is another major concern, with vaccination rates declining year after year. While many dismiss the flu as a mild illness, it is responsible for tens of thousands of deaths annually, particularly among older adults, young children, and those with underlying health conditions. The flu vaccine is not perfect, but it significantly reduces the risk of severe illness, hospitalization, and death. Yet, more and more people are opting out, convinced that the vaccine is unnecessary or ineffective. This complacency has deadly consequences. Hospitals are already strained by seasonal flu outbreaks, and if vaccination rates continue to fall, we may face even more overwhelming surges that leave healthcare systems unable to cope. One of the most dangerous aspects of vaccine hesitancy is the false sense of security that many people have. Because they have never experienced the full horror of diseases like measles, polio, or diphtheria, they assume these illnesses are no longer a real threat. But this is only because vaccines have been so successful in keeping them at bay. The moment vaccination rates drop below critical levels, these diseases come roaring back, and by the time people realize the danger, it is often too late. Outbreaks spread rapidly, and medical interventions can only do so much once an infection has taken hold. The suffering is entirely preventable, yet we find ourselves watching it unfold again, simply because people refuse to trust the science that has protected humanity for generations. The problem is exacerbated by those who exploit vaccine fears for personal or political gain. Certain groups profit from promoting alternative treatments that have no scientific backing, convincing people that they can protect themselves with vitamins, essential oils, or unproven remedies. Others push vaccine skepticism as a way to sow distrust in government and public health institutions, creating division and uncertainty where there should be clarity and unity. Every time someone spreads misinformation about vaccines, they are directly contributing to a growing public health crisis. The irony is that many of the same people who reject vaccines will be the first to seek medical intervention when they or their children fall ill. But by then, the damage has already been done, both to their own health and to the broader community. If we do not reverse this trend, the future looks bleak. More outbreaks, more hospitalizations, more deaths, particularly among those who cannot protect themselves, such as newborns and individuals with compromised immune systems. The healthcare system, already stretched thin, will continue to struggle under the weight of preventable illnesses. We may even see the return of diseases that most people have never had to fear in their lifetimes, such as polio, which still circulates in some parts of the world and could easily regain a foothold in areas with low vaccination rates. The solution is clear: rebuilding public trust in vaccines through education, transparency, and decisive action. Healthcare professionals must continue to advocate for vaccination, correcting misinformation whenever they encounter it. Social media platforms need to take more responsibility in combating the spread of harmful vaccine myths. Governments must enforce stricter policies to ensure that vaccine-preventable diseases do not gain a foothold again. And as individuals, people must recognize that their choices do not exist in a vacuum. Declining a vaccine does not only affect them but also endangers everyone around them. The time to act is now. If we continue down this path of declining vaccine confidence, we are inviting a resurgence of diseases that should have been left in the past. The suffering, the hospitalizations, the deaths, they are all preventable. But prevention requires action, and action requires trust. The question is whether society will recognize the warning signs before it is too late, or if we will allow history to repeat itself in the most tragic way possible.